Morning, I am Dr. Sefala, one of the psychiatrists at Tara Hospital. The topic is about the ADHD, which is Attention Deficit Hyperactivity Disorder. It's a common childhood disorder which presents more commonly in boys, but it can happen in females. It's a neurodevelopmental disorder which is proven to have brain changes. The clinical presentation thereof is the hyperactivity, impulsivity, as well as inattentiveness. It has to be diagnosed before the age of 12, meaning the clinical presentation should have been there by the age of 12. And importantly, it has to be into settings, either school, home, or in social situation. The other thing that is important is that it must be impairing function, meaning impact on the child's daily life to differentiate it from the normal naughtiness in childhood. The hyperactivity symptoms include child's fidgeting, leaving seats, running around, climbing up, always on the go, or like they are driven by motor, difficulty playing quietly. On the impulsivity symptoms, we have a child who talks excessively. They are intrusive. They can't wait for their turn in class. They blurt out answers. Inattentiveness shows in the form of child paying little attention to detail. They are careless. They make careless mistakes. Do not listen to when talked to. They are distracted, and as well they are forgetful or losing things that they have to use for their task. And they are also find difficulty to sustain attention. They are disorganized. They can't follow through or finish their task, and they avoid activities that require sustained mental effort. It is also important to understand that since it's a brain disease, in terms of managing it, it also requires biological, because there is biological basis to its cause. It's highly heritable. It runs in the family. It also involves the neurotransmitters in terms of being out of tune. So it requires the medication in order to help the child perform to their full potential. It is important for the teachers to be able to recognize the behavior, especially if it's persistent and it impairs the child in area of academic functioning. It is one of the commonest cause of poor performance in children at school. Once it is suspected, it's important for the teachers to bring it to the attention of the parents, and then as parents they have to make referral to start with the primary level according to the referral system of the country in terms of the healthcare. In fact, at the clinic they are able to assist and refer accordingly, and the teachers will have to be able to write a report. But there are rating scales that teachers are given to fill in to assist in some of the symptoms to help in the diagnosis of ADHD. One of the important things is to be able to understand that it is not the behavior that the child do intentionally. Is to be able to support and understand the child, because even when there are interventions, there are periods where there can be signs of relapse or what. Instead of shaming the child, scolding the child, it's important to understand that this is a brain disease and it's likely to continue. Then the child needs to be supported throughout. The other thing that is important, because we get the referrals where teachers often jump to the conclusion to tell the parents to say this child needs Ritalin. What I can say is it's better to refer accordingly than pressurizing the parents to give the child Ritalin, because there are other things that needs to be excluded before someone saying the child has ADHD. Some comorbidities, psychiatric comorbidities, and even medical conditions have to be excluded. Some causes of inattention could be mood disorders, anxiety, and that needs to be excluded.